I want all women to know about the 5 gynecological cancers. We have ovarian cancer, womb cancer, cervical cancer, vaginal cancer, and vulval cancer as well. The difficulty is a lot of women don't know about these gynecological cancers, and so they are picked up much later, sometimes at stage 3 or stage 4. But if we know how to spot the signs and pick them up early, you can get treated much earlier. So let's talk about womb cancer. It tends to happen mostly in our 40s and 50s, and that can be actually because of the changes of the hormone that's happening. Here's a little tip. If you're a woman who is postmenopausal, so by definition, you have not had a period for 1 year and 1 day, then you are in the postmenopausal phase. If you haven't had a period for 1 year and then suddenly you start getting a bleed, you must see your doctor straight away, because that could be signs of womb cancer. The other signs are that your periods are heavier or irregular or unusual, more different than you would ever notice them. Sometimes the signs of womb cancer can be very vague, so pain around the lower abdomen and the back of the legs, could be having difficulty peeing as well, loss of appetite, loss of weight. Womb cancer is easily dealt with. There are ways of preventing it as well. And this nifty little object called the Mirena coil is fantastic. It has progesterone, which lines here, and also lines the arms as well. So it's like a T shape. What progesterone does is it brings down the lining of your womb. If there's no thickening of the womb, then no cell changes can happen, and thereby no womb cancer can happen. So this is the device in the world that can prevent women from having a womb cancer. It can actually provide you the progesterone part of hormone replacement therapy. Yes, ladies, this is HRT. This can provide you hormone replacement therapy. So all you do is that you end up having progesterone put into your womb, and then on top of that, you can use something like estrogel, which is transdermal gel that you can put onto your skin. And that is an easy way of managing your hormone replacement therapy. Vulval cancer is one of the most missed cancers that we have out there when it comes to female anatomy. No one will know your vulva better than you do. Please get accommodated by getting a mirror and having a look in between your legs. We should be seeing what's down there. Get to know your labia majora and your labia minora. So those are the lips of your vulva. So if you're getting an itch around the lips of your vulva, please don't ignore that. If you're getting bleeding, if you're getting any skin changes, so any sort of white patches or red patches, get those checked out as well. If you're getting bleeding after sex, if you're getting any soreness on wiping yourself after going to the toilet, particularly if you're having a wee, an itch that doesn't go away. So itching around the lips. If you notice a lump or a warty-like lesion around the vulva, that is another thing that we should be checking out. Grab a mirror and get to know your vulva. Get to look at your lips really closely. Ovarian cancer is the most missed cancer because actually the symptoms are really vague. So some of the same main symptoms can be bloating, feeling as if you're full quite quickly after eating. You can have some period irregularity. You might find that you're tired a lot more and your weight might be going down. There is a blood test called CA125 that can be done. Now, it's not specific for ovarian cancer, but it's a starting point. And with that, we should be making sure that we get an ultrasound scan of your ovaries to have a look if there's any cysts or any masses that can be seen within your ovaries. This can mean the difference between picking up something early and picking up something late. Get accommodated by getting a mirror and having a look in between your legs. We should be seeing what's down there.